Hello, everyone. We are going to talk about telemedicine training session number 3. Uh, Telemedicine, all I can say about telemedicine is this is the benefit that's going to give employers the biggest bang for the buck. This is the game changer. Every company in America within the next 3, 4, 5 years will have telemedicine incorporated as part of their cost containment strategy. I'm certain of it because we have a severe shortage of physicians. We've got millions more people entering the system. We have a situation that is antiquated, and people who, need medicine the most are going to end up ignoring symptoms, delaying treatment, leading to more serious medical complications. A self-funded company is going to realize that if that person who's a ticking time bomb can't get into a doctor or doesn't go to a doctor because offices are overcrowded, that person's going to cost them a bloody fortune in the future. They're going to blow up. They are a time bomb. But at the other end of that extreme, you've got individuals who have, a runny nose or a sinus infection or an allergy, a minor issue. And what do they end up doing? I mean, let's just assume, Sally Smith is at work and she's got a bad allergy that she had a year ago. And she called her doctor's office and got the nurse on the line. And she said to the nurse, "Hey, nurse, this is Sally. I got this allergy I had last year at this time. Same darn thing. I know what I need. Could you write me that prescription again?" What is that nurse going to tell her? I can tell you, because 9 out of 10 people answer and say the nurse is going to say she's got to come in and see the doctor. And that's the way our medical system works. That doctor's not going to get paid unless he sees Sally. So Sally's going to end up having to leave work. What does that mean? She's absent half a day. A loss of productivity. She now goes into a room filled with sick people. She's got an allergy. She may go home sicker than when she left. Okay, she's got to wait all this time, probably sees a physician assistant or a nurse practitioner, which is not a bad thing, but the point is she might see the doctor for 2 or 3 or 4 minutes at the end of her visit, who confirms she's got an allergy, writes her a prescription, wishes her well. Now she's on her way out. She either pays her $25 copay, or if she's on a high deductible plan, she pays $100 for the visit to get what she already knew she needed. Totally inefficient and unnecessary costs associated with that. And for a self-funded company, they've had the absent employee loss of productivity, and they pick up the other $60 or $80 of that office visit, which is a waste of money. So, and then what happens on, Friday nights or weekends, or people are out in the field and they get sick? They overuse urgent care and ER centers. They're the only open doors. So what is transforming in the healthcare industry are the following access points for healthcare. We're going to still have medical offices, but they're going to be overcrowded. They're just going to be overcrowded. There's not going to be enough doctors. We're going to then see walk-in clinics and kiosks popping up in every grocery store and pharmacy. Many of us have started to see those in some of the CVS's and Rite Aids where they're experimenting. But you'll see them in grocery stores too. You're still going to see an overuse of urgent care and ER clinics after hours and on weekends. But the fastest growing segment in the healthcare delivery system will be telemedicine. And what that is doctors by phone or secure email. And they will serve as the new navigators. That's a new word for gatekeepers. They're going to be the new navigators for healthcare. They will identify what is that condition of that patient. Do they need to see a specialist? And they can be patient advocates. They can tell them, well, this is what specialist you need to go to. This is where you have to go. Or in most cases, they're going to be able to treat them. We'll talk about that in the next few slides. But the beauty of telemedicine is that it can provide immediate access to health care to everyone, no matter where they are, no matter when they need it. It is absolutely the most efficient and cost-effective method to deliver health care right now because everybody has a phone, and these doctors are available by phone or secure email. So telemedicine's actually been around for a number of years, and for those who've got clients who might have said, oh yes, we tried telemedicine in our corporation and nobody used it. Well, there's a reason. First of all, there's always pushback with a new idea. But second of all, the business model had some problems, which over the years have been getting worked out. But, what's interesting is the National Center for Policy Analysis, which is a very well-respected think tank in D.C., sort of like the Brookings Institute, except this is for healthcare, identified telemedicine several years ago as having the potential to restructure medical care, solve problems, reduce costs, and improve quality of care. They saw it. They put it in a big white paper. The Center for Health Transformation also in their white paper identified telemedicine, saying it would play an increasingly central role in getting the right care at the right time to people, particularly effective for acute, routine, episodic, self-limited, and minor illnesses. Not meant to replace primary care physicians. It is meant to treat acute minor illnesses. But as I said, the biggest challenge that telemedicine had over the years is there's still a high copay associated with it. It still costs quite a bit of money to talk to a doctor, pretty much the same as if you went to a doctor and paid a copay. What we have done, because that represents a barrier to a lot of people who aren't familiar with telemedicine. What we have done is we've eliminated that barrier. We've capitated this, so the doctor's fees are just included as part of our program. It's based on numbers. So because we have so many people in the system and a small percentage who need doctors, it all works out. So what we have in this program is we have a network in all 50 states of licensed, board-certified physicians in each state. They're available 24 hours a day, 7 days a week, 365 days a year by phone or secure email, in some cases bi-directional video, and they can diagnose and treat non-emergency routine medical conditions, and they can prescribe medications. Now, I'm going to show you a slide on the medications they can prescribe because it's not, controlled drugs or cosmetic drugs or lifestyle drugs. But the whole idea of telemedicine, the beauty of it, is not to replace a physician, not to replace your primary care physician, but to use when you can't get to your doctor, when you have just a routine non-emergent condition, when it's after hours, nights, weekends, you're out in the field, you're on vacation, or you need a prescription refill for your simvastatin, and you don't want to have to walk into the office and pay a fee. What we found this past year is out of all of the calls that came in, 94% of the time, we could successfully diagnose and treat those calls right over the phone. Only 6% were told that they had to get to a clinic or go to a specialist, and of course they were directed appropriately. 98% were satisfied or more than satisfied with this service. But even more important, and this is really significant when you're talking to employers, 64% of the callers would have gone to a doctor. 15% would have gone to an emergency room. So if you really, crunch the numbers here in terms of time and money, this is, these kind of numbers are staggering. These kind of numbers are staggering. So to answer the kinds of questions a lot of skeptics have, all these physicians, yes, are based right here in the United States. They have to be in the state, licensed in the state, from which they're calling you, from which you call. They all come out of primary care, internal medicine, or emergency room practices with many years of experience. Many of them still practice medicine and do this part-time. Some are semi-retired. They're fully credentialed by the same organization that credentials them to work in hospitals and trained specifically in telemedicine. And this list of common conditions treated, this is the same list of conditions that all primary care physicians see on a daily basis 80% of the time. This is what 80% of the claims in the healthcare system are. Not 80% of the cost, just 80% of the claims. Colds, flu, sore throat, bronchitis, allergies, sinus respiratory infections. You can see the list, but these are all minor routine conditions that doctors can easily treat on the phone and prescribe if necessary. Okay, their scope of work is very well defined and limited to evidence-based situations. When the symptoms exceed the scope of their services on the phone, they refer a patient to a physician. This is why I say they are not only the navigator but the patient advocate, because with companies where they're working directly with, say, a self-funded company, we could actually plug in the network, the physician network, for so that our telemedicine physicians can direct employees to a doctor that's in network. That's how sophisticated it gets. All their records are electronic and compatible with the continuity of care records supported by the AAFP. So this is one thing that people want to know. The other is there's always a question about what kind of drugs can they really prescribe. People could take advantage of it. They really can't. There's no controlled substances. This is the typical list. The other thing that these doctors have access to that your doctor doesn't while he's in the office looking at you is they can actually see in real time all the prescriptions that patient has received in the last 24 months. So they know if this person calls in all the time or what kind of drugs they've been on or if they order drugs too often. But the drugs on this list are very basic that treat these types of acute episodic conditions. So I always like to bring up return on investment because, why does a company, why are they going to buy this benefit package for their employees? Most companies don't do something just for the good of the employees. It's got to be financially make sense. Okay, and you can't promise an ROI because there's a lot of variables. And until we've identified all the variables, then we can pretty much give them some projections. But I have found that if a company, buys our complete package, okay, of benefits, the telemedicine alone can give them close to a 2-to-1 return on their investment if they can get up to 25% of their employees to start calling the doctor before they go to the doctor. So imagine if every corporation encouraged a call first policy. Imagine if in a few years to come some of your clients required a call first policy. If that was the case, they would literally reverse their healthcare costs. They would reduce healthcare costs for the next several years instead of increasing as they have for many, many years. So that's why I say telemedicine is absolutely the game changer that will save the employer a lot of money, and it is easy to measure. You can document, how many people have registered, how many people have called. We do the surveys. We know what percentage of office visits, ER visits we have saved, and we can show an employer a pretty good ROI in a very short time. And once they're at break even, you'll never hear from them again. They're going to be heroes. So that's pretty much it on telemedicine. Next thing we'll talk about is our other core benefits.